"Don't talk," the patient whispered from his hospital bed. The nurse froze, her hand still clutching the chart against her chest. At first, she thought it was the fever talking, just another delirious patient. But then she saw his eyes, sharp, desperate, terrified. And what he revealed inside that hospital room would not only save her life, it would shock everyone who heard it. Stay with me until the end, because this story will leave you stunned. Before we begin, don't forget to like this video, hit subscribe, and comment where you're watching from. Now, let's get started. Sarah Mitchell had been walking these hospital corridors for 12 years. She knew every sound, every shadow, every routine that kept St. Mary's Medical Center running through the night. The third shift at the intensive care unit was supposed to be peaceful. Most patients were resting, machines hummed their steady rhythms, and the hallways echoed with nothing but her soft footsteps and the distant chatter from the nurses' station. But tonight felt different. Tonight, something was wrong. Sarah adjusted her stethoscope around her neck as she made her rounds, checking vitals and medication schedules. Room 314 housed her most challenging patient, Thomas Green, a construction worker who'd been admitted 3 days ago after a workplace accident. His injuries weren't life-threatening, but the pain medication had made him restless and confused. She expected another night of rambling complaints and requests for extra pillows. What she didn't expect was the look of pure terror in his eyes when she entered his room. Thomas was sitting upright in his bed, despite doctors' orders to rest. His face was pale, sweat beading across his forehead, even though the air conditioning kept the room cool. The heart monitor beside his bed showed an elevated pulse, beeping faster than normal. Sarah immediately moved toward the machine, thinking he was having some kind of episode. "Mr. Green, you need to lie back down," she said softly, reaching for his shoulder to guide him back to his pillow. "Your heart rate is elevated. Are you experiencing chest pain?" That's when he grabbed her wrist, his grip surprisingly strong for someone who'd been sedated just hours earlier. His eyes darted toward the door, then back to her face, filled with an urgency she'd never seen before. "Don't talk," he whispered, his voice barely audible above the hum of medical equipment. "They're listening." Sarah's first instinct was to check his chart again. The medication schedule showed he'd received morphine at 10 o'clock, nearly 4 hours ago. Patients sometimes experienced confusion or paranoia as pain medication wore off, especially when mixed with the stress of hospitalization. She'd seen it countless times before, but something about Thomas's demeanor made her pause. His eyes weren't glazed or unfocused, like someone experiencing drug-induced hallucinations. They were alert, scanning the room methodically, like someone who'd spent years on construction sites, learning to spot danger before it struck. "Mr. Green," she said gently, trying to keep her voice calm and professional, "you're safe here. This is St. Mary's Hospital. You were in an accident at work, remember? You fractured 2 ribs and had some internal bruising, but you're going to be fine." Thomas shook his head violently, his grip tightening on her wrist. He pulled her closer to the bed, close enough that she could smell the antiseptic soap they'd used to clean his wounds and see the genuine fear flickering in his eyes. "Listen to me very carefully," he whispered, his voice so low she had to lean in to hear him. "The doctor who operated on me, Dr. Harrison. He's not who you think he is." Sarah felt her heart skip a beat. Dr. Richard Harrison was one of the most respected surgeons at St. Mary's. He'd been with the hospital for over 15 years, had performed thousands of successful operations, and was known for his dedication to patient care. The idea that something was wrong with Dr. Harrison seemed impossible. "Mr. Green, you're confused," she said, though her voice lacked the conviction she'd intended. "Dr. Harrison saved your life. He's a wonderful surgeon." "No," Thomas insisted, his eyes never leaving hers. "I wasn't unconscious during the surgery. The anesthesia didn't work properly, but I couldn't move or speak. I heard everything." Sarah's blood ran cold. Anesthesia awareness was a rare but terrifying complication where patients remained conscious during surgery, but couldn't communicate their distress. She'd read about it in nursing school, studied the psychological trauma it could cause, but had never encountered a case herself. "What did you hear?" she asked, though part of her didn't want to know the answer. Thomas glanced at the door again, then back to her face. "He wasn't operating to save me. He was putting something inside me, something that doesn't belong there." The words hung in the air between them like a poison gas. Sarah's mind raced through possibilities. Medical implants were common in modern surgery. Pacemakers, metal plates, surgical mesh. Perhaps Thomas had misunderstood what he'd experienced during his conscious state. "Mr. Green, sometimes surgeons need to insert medical devices to help with healing," she explained. "If Dr. Harrison placed something inside you, it was for your recovery." "This wasn't medical," Thomas said, his voice growing more urgent. "It was electronic, small, about the size of a pill, and he didn't put it where my injuries were. He made a separate incision, higher up near my chest cavity." Sarah felt the room temperature drop several degrees. She pulled her wrist free from Thomas's grip and stepped back, her mind struggling to process what he was telling her. If what he was saying was true, if Dr. Harrison had implanted some kind of electronic device during surgery, it would be a massive violation of medical ethics and possibly criminal. But why would Dr. Harrison do such a thing? What possible reason could one of the hospital's most trusted surgeons have for secretly implanting electronic devices in patients? "There's more," Thomas continued, watching her face carefully. "After he finished with the device, he made a phone call, right there in the operating room. He said the package was delivered and the subject would be ready for phase 2 in 72 hours. Sarah's legs felt weak. She gripped the bed rail for support, trying to make sense of what she was hearing. Phase 2 of what? What kind of package? And why would Dr. Harrison refer to Thomas as a subject instead of a patient? "Mr. Green, these are very serious accusations," she said, her voice barely steady. "If what you're saying is true, we, the police, Thomas Grab, need to report this immediately. We need to call wrist again," moored her W gently this time, but with the same desperate urgency. "No, you can't call anyone from inside this hospital. Dr. Harrison isn't working alone. I heard him talking to someone else in the room, someone who was supposed to monitor me after the surgery. They have people everywhere in this building." The implications hit Sarah like a physical blow. If Thomas was right, if there was some kind of conspiracy involving hospital staff, then calling for help through normal channels could put both of them in danger. But if she didn't report what she'd heard, and Thomas was telling the truth, then other patients could be at risk. "What am I supposed to do?" she whispered, more to herself than to Thomas. "You need to get me out of here," he said, his voice filled with quiet determination. "Tonight, before they come back for phase 2. Sarah stared at Thomas, her mind spinning like a broken compass. Get him out of the hospital? The idea was insane. Patients didn't just disappear from intensive care units. There were security cameras, electronic monitoring systems, medication schedules, and dozens of staff members who would notice an empty bed within minutes. But as she looked into Thomas's eyes, she realized something that made her stomach drop. He wasn't asking her to help him escape because he was paranoid or delusional. He was asking because he genuinely believed his life was in danger. "Mr. Green, even if what you're saying is true, I can't just walk you out of here," she whispered back. "You're connected to monitoring equipment. Your heart rate, blood pressure, oxygen levels, everything is being tracked at the nurses' station. The moment we disconnect you, alarms will sound throughout the entire floor." Thomas nodded, as if he'd already considered this problem. "What time do the shifts change?" Sarah checked her watch. It was nearly 2 in the morning. 7 a.m., but that's 5 hours away. And if they're planning phase 2 within 72 hours, we might not have that long. "What about the laundry service? When do they collect the dirty linens?" The question caught Sarah off guard. In 12 years of nursing, she'd never paid attention to the exact schedule of housekeeping services. They came and went throughout the day and night. wheeling large canvas carts through the corridors, collecting soiled bedding and surgical gowns. "I think they make rounds every few hours," she said slowly, beginning to understand where his thoughts were heading. "But Thomas, you can't seriously be thinking about hiding in a laundry cart. You have fractured ribs. The movement alone could cause internal bleeding." "Internal bleeding won't matter if I'm dead," Thomas replied grimly. "And whatever they put inside me, whatever this phase 2 is, I don't think it's designed to keep me healthy." Sarah felt her hands trembling. Everything about this situation violated every protocol she'd ever learned. If Thomas was wrong, if his claims were the product of medication-induced paranoia, then helping him leave the hospital could result in his death and the end of her career. But if he was right, if Dr. Harrison had indeed implanted some kind of tracking or monitoring device during surgery, then staying could be even more dangerous. "There's something else you need to know," Thomas continued, his voice dropping even lower. "Before the surgery, Dr. Harrison asked me questions that had nothing to do with my injuries. He wanted to know about my family, where I lived, whether I had any military experience. At the time, I thought he was just making conversation to calm my nerves, but now I realize he was gathering information." Sarah's blood turned ice cold. "What kind of information?" "He asked if I lived alone. He asked about my work schedule, whether I traveled for construction jobs. He asked if I had any medical conditions that required regular doctor visits." Thomas paused, his eyes scanning the room again. "He was profiling me, looking for someone who wouldn't be missed if something went wrong." The pieces of a horrifying puzzle began falling into place in Sarah's mind. If someone wanted to conduct illegal medical experiments, they would need test subjects who were isolated, transient, people whose disappearance wouldn't trigger immediate investigations, construction workers who moved from job site to job site, who often lived alone and worked irregular schedules, would be perfect candidates. "How many other patients has Dr. Harrison operated on recently?" she asked. Though she dreaded the answer, Thomas's expression darkened. "I've been listening to conversations in the hallway for 3 days. From what I can tell, there have been at least 4 other cases in the past month, all of them men between 30 and 50, all of them admitted for relatively minor injuries that required surgery." Sarah felt dizzy. If Thomas was right, if Dr. Harrison was systematically selecting and operating on vulnerable patients, then St. Mary's Hospital had become the center of something far more sinister than medical malpractice. This was human experimentation on an organized scale. "We need evidence," she whispered. "If we're going to expose this, we need proof that can't be dismissed or covered up." Thomas reached under his hospital gown and winced as he touched his chest. The incision site where he put the device. "It's not in my medical records, is it?" Sarah quickly flipped through his chart, scanning the surgical notes that Dr. Harrison had filed after the operation. According to the official documentation, the surgery had involved repairing internal bleeding and stabilizing 2 fractured ribs. There was no mention of any additional incisions or implanted devices. "No," she said, her voice barely audible. "There's no record of any secondary procedure." "Then photograph it," Thomas said, pulling his gown aside to reveal his chest. "Document the incision that's not supposed to exist." Sarah stared at Thomas's chest, and her heart nearly stopped. There, about 4 inches above the documented surgical site, was a small but clearly visible incision. The wound was fresh, held together with surgical glue rather than stitches, and positioned in a location that would have no relevance to treating fractured ribs or internal bleeding from a construction accident. Her hands shook as she pulled out her phone. This was evidence that couldn't be explained away or dismissed as patient confusion. This was proof that Dr. Harrison had performed an undocumented procedure during Thomas's surgery. As she took several photographs from different angles, Sarah's mind raced through the implications. If Dr. Harrison was implanting devices in patients without their knowledge or consent, what was the purpose? Were they tracking devices? Experimental medical technology? Or something even worse? "There's a storage room on the 3rd floor," Thomas said, as she finished documenting the evidence. "I saw them wheeling equipment in there yesterday. Stuff that didn't look like normal medical supplies. If we could get inside, we might find more evidence of what they're doing." Sarah looked at her watch again. 3:15 in the morning. The hospital was at its quietest during these hours, with minimal staff on duty and most patients sleeping. If they were going to investigate further, now would be the best time. But first, she needed to ensure Thomas's safety. Whatever was in that storage room, whatever Dr. Harrison was planning for Phase 2, it was clear that Thomas had stumbled onto something that powerful people wanted to keep secret. And in her 12 years of nursing, Sarah had learned that people who threatened powerful secrets had a habit of disappearing. "We're going to get through this," she told Thomas, though she wasn't sure she believed her own words. "But we need to be smart about it. One mistake and we'll both end up as test subjects." Thomas gripped the bed rail, his knuckles white against the metal. "Sarah, there's something else. Something I didn't tell you because I wasn't sure if I believed it myself." Sarah moved closer, her heart hammering against her ribs. The photographs of the mysterious incision were still displayed on her phone screen, undeniable proof that something terrible was happening within these walls. But Thomas's expression told her the worst revelations were yet to come. "What is it?" she whispered, glancing toward the door. The hallway remained silent except for the distant hum of fluorescent lights and the soft beeping of monitors from other rooms. During the surgery, when I couldn't move or speak, but could hear everything, Dr. Harrison wasn't alone. There were other voices in the room, people I didn't recognize. Thomas paused, sweat beading on his forehead despite the cool air. But there was one voice I did know, someone who's been checking on me every day since the operation. Sarah felt the blood drain from her face. "Who?" "Dr. Chen, the anesthesiologist." The name hit Sarah like a punch to the stomach. Dr. Lisa Chen had been at St. Mary's for 8 years, working closely with surgical teams throughout the hospital. She was known for her precision, her calm demeanor under pressure, and her dedication to patient safety. The idea that she could be involved in something this sinister seemed impossible. "That can't be right," Sarah said, though her voice lacked conviction. "Dr. Chen is one of the most respected doctors in this hospital. She's saved countless lives." Thomas shook his head grimly. I heard her voice clearly. She was discussing dosage levels with Dr. Harrison, but not for anesthesia. They were talking about something called Compound 7. She said the previous subjects had shown adverse reactions at higher concentrations, but that my physical condition made me a better candidate for the full dose. Sarah's medical training kicked in, searching her memory for any reference to Compound 7. She'd never heard of it in any pharmaceutical database or medical journal. Whatever it wasn't part of standard medical practice. "There's more," Thomas continued, his voice dropping to barely above a whisper. Dr. Chen mentioned that the research team was pleased with the preliminary results. She said they were ready to move to human trials on a larger scale, and that St. Mary's had been selected as the primary testing facility. The implications crashed over Sarah like a tidal wave. If Thomas was telling the truth, then St. Mary's Hospital wasn't just harboring one corrupt surgeon. It was serving as a front for illegal human experimentation involving multiple doctors, possibly the entire administration. "How many people are involved?" she asked, though she wasn't sure she wanted to know the answer. "Hatokitsam. I don't know for certain, but from the conversations I overheard, it sounds like there's a whole network. Dr. Harrison handles the surgical implantation. Dr. Chen manages the chemical compounds, and there's someone called the coordinator who oversees patient selection and scheduling." Sarah felt sick to her stomach. "Patient selection? You mean they're deliberately targeting specific people?" Thomas nodded. "The coordinator has access to medical records, insurance information, family histories. They're looking for people who fit a certain profile. People like me who won't be missed immediately if something goes wrong." The weight of what Thomas was revealing pressed down on Sarah's chest like a physical force. This wasn't just medical malpractice or even criminal experimentation. This was a systematic program designed to exploit the most vulnerable patients in the healthcare system. "We have to get you out of here," she said, her voice filled with new urgency. "If they're planning phase 2 within 72 hours, and it's been 3 days since your surgery, then we're almost out of time." Thomas struggled to sit up straighter, wincing as the movement aggravated his fractured ribs. "There's a problem with that plan. The device they implanted, whatever it is, I can feel it. Not just physically, but there's something else. Since yesterday, I've been having strange sensations. Moments where I feel like I'm not entirely in control of my own thoughts." Sarah stared at him, horror dawning in her eyes. "What kind of sensations?" "It's hard to explain. Sometimes I'll be thinking about something completely normal, like what I want for breakfast, and suddenly I'll have this overwhelming urge to do something else. Yesterday, I felt compelled to call a phone number that I didn't recognize. The urge was so strong that I actually reached for the phone before I caught myself." The room seemed to spin around Sarah. If the implanted device was capable of influencing thoughts or behavior, then they weren't just dealing with medical experimentation. This was something far more sinister, something that bordered on mind control. "Thomas, listen to me very carefully," she said, gripping his hand. "We need to document everything you've told me, but we can't do it here. Too many people have access to hospital computers and phone systems. Is there somewhere safe we can go? Somewhere off hospital grounds where we can contact the authorities?" Thomas thought for a moment. "My apartment is only 10 minutes away, but I don't know if it's safe. If they've been monitoring me since the surgery, they probably know where I live. What about family? Friends? Anyone who could help us? My sister lives about an hour north of the city. She's a paralegal, works for a law firm that handles medical malpractice cases. If anyone would know how to handle this situation, it would be her." Sarah felt a spark of hope, for the first time since Thomas had grabbed her wrist. A paralegal with experience in medical cases would understand the legal implications of what they'd discovered and know how to present the evidence to authorities in a way that couldn't be dismissed or covered up. "Can you travel that far with your injuries?" she asked. Thomas gritted his teeth and swung his legs over the side of the bed. "I'll have to. The alternative is letting them finish whatever they started." Sarah checked her watch. 3:30 in the morning. The night shift change wouldn't happen for another 3.5 hours, but waiting that long might be too dangerous. If Dr. Harrison or Dr. Chen decided to check on Thomas unexpectedly, they would discover that he knew about their activities. "I need to disconnect your monitoring equipment," she said, moving toward the machines that tracked his vital signs. "The moment I do this, alarms will sound at the nurse's station. We'll have maybe 2 minutes before someone comes to investigate." Thomas stood up slowly, testing his balance. Despite his injuries, he seemed steady on his feet. "What's the plan?" Sarah's mind raced through the hospital's layout, thinking about security cameras, staff schedules, and escape routes. The laundry service entrance is on the ground floor, near the loading dock. If we can make it there without being seen, we can slip out when they make their next pickup. And if we're caught? Sarah looked into Thomas's eyes, seeing her own fear reflected back at her. Then we become test subjects ourselves. She reached for the heart monitor, her hand hovering over the power switch. Once she pressed it, there would be no going back. They would be committed to a course of action that could save lives or get them both killed. "Are you ready?" she asked. Thomas nodded. "Do it." Sarah pressed the switch, and immediately the room filled with the sharp, urgent sound of flatline alarms. The heart monitor's screen went dark, and within seconds, similar alarms began echoing from the nurse's station down the hall. "Move," Sarah whispered, grabbing Thomas's arm and helping him toward the door. They stepped into the hallway, just as the first responding nurse rounded the corner from the station. Sarah recognized her immediately. Janet Morrison, a 20-year veteran who worked the night shift in the intensive care unit. But as Janet approached, Sarah noticed something that made her blood run cold. Janet wasn't rushing toward the alarm like a concerned medical professional. She was walking calmly, deliberately, like someone who had been expecting the alarm to sound. and in her hand, she carried something that definitely wasn't standard medical equipment, a syringe filled with clear liquid. Going somewhere, Sarah?" Janet asked, her voice carrying none of the warmth it usually held during their casual conversations. "I think Mr. Green needs to get back to his room. Dr. Harrison is very interested in monitoring his recovery personally." Sarah felt Thomas tense beside her. They were trapped in the hallway, caught between Janet and whatever other staff members might be part of the conspiracy. The exit was still 50 yards away, and with Thomas's injuries, running wasn't an option. "Janet, I don't know what's going on here, but Thomas needs immediate medical attention," Sarah said, trying to keep her voice steady. "His monitor malfunctioned, and I was taking him for emergency evaluation." Janet smiled, but there was no humor in it. "Oh, Sarah, you always were too curious for your own good. Dr. Harrison mentioned that you might become a problem eventually. That's why we've been keeping such a close eye on Mr. Green's room." The pieces clicked into place in Sarah's mind. They had been watching, waiting to see if Thomas would reveal what he'd witnessed during surgery, and now that he had, both of them were in immediate danger. "What's in the syringe, Janet?" Sarah asked, though she suspected she already knew the answer. "Compound 7, Janet replied matter-of-factly. "A much higher concentration than what Mr. Green received during surgery. Dr. Chen assures me that at this dosage, the effects are quite permanent." Thomas stepped protectively in front of Sarah. "You're not touching her." Janet laughed softly. "Mr. Green, you're hardly in a position to make threats. In about 30 seconds, Dr. Harrison will arrive with security. Your little escape attempt ends here." But as Janet spoke, Sarah noticed something she hadn't seen before. The emergency exit at the end of the hallway had a small red light above it, indicating that it was alarmed. But the light wasn't glowing. Someone had disabled the alarm system. It wasn't a coincidence. Someone else was in the hospital. Someone who wanted them to escape just as badly as they wanted to get out. Sarah grabbed Thomas's hand and whispered, "Run." They burst through the emergency exit into the cold night air, Thomas stumbling but forcing himself to keep moving. Sarah's heart hammered against her ribs as they crossed the empty parking lot, expecting at any moment to hear shouts behind them or see security guards streaming from the building. But the hospital remained eerily quiet. "This way," Thomas gasped, pointing toward a cluster of employee vehicles parked near the far edge of the lot. "My truck is over there." Sarah glanced back at the hospital. Through the windows of the intensive care unit, she could see figures moving frantically. Janet would have discovered their escape by now. Dr. Harrison would know his secret was compromised. How long before they called in reinforcements? "Thomas, your keys," she said urgently as they reached his pickup truck. He patted his hospital gown, panic flashing across his face. "They're not here. Hospital security must have taken them when I was admitted." Sarah's mind raced. They were stranded in a parking lot, Thomas barely able to walk, with a conspiracy of doctors and nurses who would stop at nothing to silence them. Her own car was parked in the staff section, but reaching it would mean crossing back toward the hospital entrance. "Wait," Thomas said, feeling along the truck's wheel well. "I keep a spare key hidden here for emergencies." His fingers found the small magnetic box, and he pulled out a key with trembling hands. They climbed into the truck, Sarah helping Thomas into the passenger seat before sliding behind the wheel. She'd never driven his vehicle before, but there was no time to adjust mirrors or familiarize herself with the controls. She turned the key, and the engine roared to life. "Which way to your sister's house?" she asked, backing out of the parking space. "Take Highway 9 north," Thomas said, wincing as the truck's movement aggravated his injuries. "But Sarah, we need to be careful. If they've been planning this for months, they probably have resources we don't know about. People in law enforcement, maybe even federal agencies." Sarah felt her stomach drop. She'd been thinking of this as a local hospital conspiracy, something that could be exposed to city police or state medical boards. But if Thomas was right, if this network extended beyond St. Mary's, then nowhere might be truly safe. As they drove through the empty streets, Thomas continued talking. his voice growing stronger despite his physical pain. "During the surgery, I heard Dr. Harrison mention something about a timeline. He said the program needed to be fully operational within 6 months, that they already had facilities prepared in 12 other cities." 12 other cities, Sarah repeated, the words feeling like poison in her mouth. "Thomas, this isn't just about St. Mary's. This is something huge. The device they put in me," Thomas continued, touching his chest gingerly. "I've been thinking about what it could be, the way it affects my thoughts, the compulsions I feel. What if it's not just tracking my location? What if it's designed to control behavior on a larger scale?" Sarah's blood ran cold. "You mean like mind control?" "Think about it," Thomas said, his voice growing more urgent. "If you could implant devices in people without their knowledge, if you could influence their thoughts and actions remotely, what would that be worth to someone with power? Governments, corporations, criminal organizations." The implications were staggering. Sarah tried to focus on driving, but her mind kept spinning through the possibilities. If Dr. Harrison and his team had perfected a way to control human behavior through implanted devices, they weren't just conducting medical experiments. They were developing weapons. "Your sister," she said, needing to focus on something concrete. "What's her name? How do we know we can trust her?" "Rebecca Martinez. She's worked for Davidson and Associates for 8 years, specializing in medical malpractice and pharmaceutical liability cases. If anyone knows how to handle evidence like this, it's her." Sarah felt a glimmer of hope. A paralegal with experience in medical cases would understand the legal implications of what they'd discovered. More importantly, she would know how to protect evidence and present it to authorities who couldn't be bought or intimidated. They drove in silence for several minutes, the city lights giving way to suburban neighborhoods and then rural darkness. Sarah kept checking the rearview mirror, but the road behind them remained empty. Maybe they had escaped cleanly. Maybe Dr. Harrison's network wasn't as extensive as they'd feared. That's when she noticed the headlights. 2 vehicles, traveling fast, gaining ground steadily. They'd appeared suddenly, as if they'd been waiting at a predetermined location, rather than following from the hospital. "Thomas," she said, her voice tight with fear, "we have company." He turned in his seat, grimacing at the movement. How did they find us so fast? They never made it to Rebecca's house that night. The tracking device in Thomas's chest led Dr. Harrison's team straight to them within hours. But Thomas had prepared for this possibility. Before they escaped the hospital, he'd managed to upload Sarah's photographs and a detailed voice recording to a secure cloud server that Rebecca could access remotely. 3 months later, federal investigators raided St. Mary's Hospital and 11 other medical facilities across the country. They found evidence of the largest illegal human experimentation program in modern history. Dr. Harrison, Dr. Chen, and 43 other medical professionals were arrested. The devices they'd implanted were designed to test remote behavioral modification technology for an undisclosed government contractor. Thomas survived the removal surgery, though he still experiences occasional memory gaps from his ordeal. Sarah returned to nursing at a different hospital, where she now advocates for patient rights and surgical transparency. The investigation revealed that over 300 patients had been unknowingly implanted with experimental devices. Sometimes the people we trust most with our lives are the ones we should fear the most. And sometimes, a whispered warning from an unlikely source can expose the darkest secrets hidden behind sterile walls and trusted faces.